Cecilia is a medical anthropologist, and she's interested in applied health research and also in developing these rapid approaches to research. And I think, Cecilia, when I contacted you to do this, one of the, although PGRs have 3 years, they do have this sense that time goes so quickly, and they have to do all these things quite quickly because they have very determined timescales to get the fieldwork done, because of the processes of the upgrade and the Viper and all those things. So Celia is ideal because she's got this rapid qualitative research background. She's written a lot about it. She co-directs the rapid research evaluation and appraisal lab that's called RREAL, and she's constantly working with different interdisciplinary teams. I've heard her speak in the past. You came to the University of Leeds to talk to one event where you were talking about an ethnography you did, I think, with children that had cancer. Am I right, Cecilia? Yeah. And I was fascinated by the whole, in the narrative and what, your findings and everything. And then I've been following you, and you're rapid, your rapid ethnography. And I thought this is exactly what we need in our advanced qualitative training for our PGR. So thank you so much. We're all looking forward to listening to your techniques and your advice about how to do this. And off you go.
Excellent. Good. I'm just going to make sure that you can see this slide. Yes?
Yes, we can.
Excellent. All right. Well, thanks so much for the invitation. Really happy to be here. Always really excited to talk about these approaches, especially with PhD students and with early career researchers. And I actually deliver at RREAL, as you saw in the previous slide, we do all these sorts of online training, but I actually have developed one on rapid ethnographies that I teach for the UCL doctoral school, and I've tried to take quite a few elements from that doctoral training and put that into these slides, because I feel that many times the experiences of doctoral students with rapid ethnographies are slightly different to the rapid ethnographies that we normally do kind of outside of a doctoral program as part of larger teams. So hopefully some of the tips here will be useful for you. I've organized a session as a really practical session. I'm going to spend a bit of time at the beginning giving you kind of a wider sense of what are rapid ethnographies, where do they fit into kind of this wider field of rapid research methods. But then I've left some really practical slides towards the end that I think there's tools there that you could incorporate into your own studies, even if you're not doing a rapid ethnography, but if you want to speed up a few of the stages of your research as well. And what Anna was saying around doctoral programs being quite long, but still students feeling quite a bit of pressure is something that I see all the time, not only with my own doctoral students, but also the ones that we teach. And there is this sense of, I've spent a year preparing for the upgrade or doing a systematic review that will then inform my study. I want to have plenty of time at the end for kind of writing, and then I find myself where I've got maybe 6-9 months really for field work after ethics and all that. What am I supposed to do with this really short amount of time in order to develop a high quality piece of work but still deliver my PhD on time? So that's kind of where this course sits, and why it's, I think, even within our university, it's become more popular over the years. And of course, compounding that with some of the effects of COVID-19 and the fact that many had to change topics or adapt their study designs to deal with some of the restrictions, right, around face-to-face research. And we can have a chat about that, because we've done lots of work during COVID-19 as well, where we've had to adapt some of these tools to more remote data collection. So happy to talk about it. So first things first. So Anna introduced me already. One of the things I always say is I always present on behalf of a wider team. It's not just me. I lead a team called the Rapid Research Evaluation and Appraisal Lab. And one of the first things I like to do is to present the team, to discuss what the team does, because in the slides that you'll see later, all of the kind of tips, tools, even some of the case studies come from the work that the team has done. So I think it's good to hear about the team first, and then we can move on to the rest of the slides. And I've got an animation. Hopefully the sound we checked it was working. This wakes us up.
The Rapid Research Evaluation and Appraisal Lab uses research to improve healthcare systems, programs, and interventions delivered in time-sensitive contexts. RREAL is a multidisciplinary team with expertise in qualitative and quantitative research. RREAL delivers face-to-face and online training, carries out rapid literature reviews, quick appraisals, rapid ethnographies, and evaluations, and advises other teams or organizations on the use of rapid research approaches. Current areas of research include the organization and management of healthcare delivery, the use of rapid qualitative research in clinical trials, global health and complex health emergencies. For more information, please visit our website.
All right, so quick introduction. Sorry, I have to put my headphones back in to get better sound quality. I hope you can hear that. Brief introduction in terms of the team. Now, brief plan for the day. Like I said before, we'll look at the reasons why you might want to engage with some of these more rapid designs. We'll talk about what we mean by rapid ethnographies and also some variations around definitions of these approaches. We'll touch on the challenges of doing this work, when it's actually suitable to use a rapid design and when you might want to avoid it. And then I'll go through all the stages from study design, data collection, analysis, and most importantly for us as an applied health research team, looking at dissemination and the use of our findings to inform changes in policy and practice. Bit of housekeeping, just some info here on how to contact the team and how to follow the work in case you're interested. Our website has lots of info as well if you're interested in looking at some of the publications that I'll be referring to today. We've got 2 hours, I think, towards the kind of hour mark. We might want to have a quick comfort break, so I'll let you know when that comes. Maybe a few minutes I think would be appropriate. And I've organized the slides so that we've got, hopefully, if I don't ramble for too much as I'm presenting, we should have some time at the end for discussion, because I really like to have a bit of time where you might want to talk about your projects, and we could do a bit of troubleshooting if you're encountering some issues where some of these approaches might be useful. But I will also stop throughout the session today, so and ask if there's any questions, especially if I've gone over quite a bit of information. So I'll stop if you want to raise your hand or pop questions in the chat, and it's going to be monitoring the chat, and she can let me know. But if you're not talking, just so everyone can kind of enjoy the presentation, if you want to keep yourselves on mute, that would be great. As I mentioned, the session is also being recorded, so I think if you don't want your camera shown, then you might want to turn that off as well. All right, so aims of the course. We're going to talk about a wide range of approaches. We're going to talk about contributions and limitations, and looking at improving your skills on all the stages of rapid ethnographic research, design, and implementation. And then one of the first things I like to do is I like to start with a slide around just to get us thinking about why we actually need these approaches to begin with. So why do we need rapid research in general? And then we can talk about rapid ethnographies. So there's many, and here, there's some reasons that might be more, I think, relevant for you as PhD students or early career researchers, and there's others that might be more relevant for kind of teams working beyond that kind of setting. But I think a key kind of shared reason is the fact that there are many times time or yes, definitely time and financial pressures that teams or researchers face, especially in the context where we work. And we normally do a lot of work in healthcare, and we always say that the healthcare climate is constantly changing, and if research is meant to inform any type of decision making, or if we want to use our research findings to inform changes in policy and practice, we probably need to think about how we design our research so it is timely. So we think about timeliness as a variable. And one of the key things of many of these approaches is that they've tried to address a gap that continues to exist between the work that we do in academia, within university settings, and the work that happens outside of that. It could be a healthcare sector, it could be social care, it could be education, it could be many of the kind of sectors that you've mentioned in your studies as well. So trying to bridge that gap, and that's where many of these approaches have been developed as a result of that. Another thing to think about, and the reason why many researchers engage with these approaches, is that many times there are topics that are time sensitive. And we definitely saw this, for instance, we do lots of work within the context of infectious epidemics, Ebola, Zika, and now with COVID-19 as well. And it's not just epidemics, but there's many research topics that are time sensitive in the sense that if you do not capture what's happening in real time, if you're not able to track things as they're evolving, you're going to lose quite rich and really valuable information. And that's where many of these approaches, with their quite dynamic and very iterative designs, become really useful. So instead of doing, let's say, a retrospective piece of work, which is a decision, for instance, that with COVID-19 we had to make as a team, we said, okay, should we rapidly set up, get something going? And we did some work looking at the experiences of healthcare workers delivering care during the pandemic. So we had a decision to make around January 2020, late December 2019, early January 2020, saying, okay, we're going to move and mobilize as a team to set up the study really rapidly so we can track this pandemic in real time, creating feedback loops so we can share findings with organizations and they can use those findings to inform epidemic response efforts? Or are we going to wait a while and actually wait for some of this to pass and do a retrospective piece? And I'm sure you know what the answer to that is. We went with the first option, and we've been tracking the pandemic even up until today, considering some of these really interesting changes in the ways in which healthcare workers have perceived and have experienced delivering care during the pandemic in the UK, but also at a global scale as well. So various different reasons here. Another really interesting one is the fact that what many of these authors developing these approaches have demonstrated is that you don't always need to have a more long-term or more traditional ethnographic research design to answer your research questions. So many times rapid approaches could actually allow you to answer research questions and can produce quite high quality pieces of work without you needed to have an extended amount of time in the field or having to have an extended amount of time for data analysis. And we'll take a look at how you might be able to do that in practice as well. And of course, there's always costs, and this is coming from someone who did her PhD on a shoestring, I guess. And so I had to actually engage with some of these rapid ethnographies quite early on in my career because I did not have funding to be able to do my fieldwork in a different country at the time. And so I had to be quite creative with the way in which I designed my study. So reasons why we might use them. And now what do we actually mean by some of these kind of rapid methods? What makes them different? So there's no real consensus out there, but I always point people in the direction of this systematic review by McNally and Foster-Fishman. It's slightly old, but I think it gives you a nice overview. And one of the things I haven't mentioned that I thought I should is that I've got a whole list of resources that I can send to Anna after this session that has all of these references plus many, many more. So the idea of today, there's a limit to what I can do in 2 hours. It's more of a signposting exercise, but hopefully if you're interested in these approaches, then if I send that to Anna, she can distribute to everyone and you could do a bit more reading. Okay, so going back to this. So McNally and Foster-Fishman set out to create this review where they wanted to map the field of what they called Rapid Research and Evaluation Methods, or RREAM. And what they found was actually really interesting diversity of approaches, but they felt that these approaches all share the 4 core elements that I've circled for you here at the bottom. So these approaches were rapid in the sense that they could be carried out within a few weeks to a few months. They had some degree of participatory research in the sense that they might include community members or other stakeholders in the design or even in the implementation of the research. They tended to be team-based, this idea that if you've got a team, you can potentially cover more ground in a shorter amount of time, but also that you might want to design your team so that you're bringing in expertise maybe from different fields, different levels of experience, or even bringing in people with lived experience into your team to share their knowledge as well. And you could develop richer pieces of work with more kind of interpretive layers in that sense. Now, having said that, within the field of rapid ethnographies, there's still a tendency to have many rapid ethnographies implemented under what we call a lone researcher model. So the individual researcher actually doing all of the research, and we'll touch on that. And I think that's quite relevant for many of you as well as doctoral students. Many of these approaches tend to have an iterative design, this idea that you will look at research as a series of repetitive cycles where you might even carry out some stages in parallel. In rapid ethnographies, it's always data collection and data analysis, carrying those in parallel, being able to make sense of your findings as you're collecting data, maybe sharing those findings with stakeholders if you're able to, taking their feedback and using their feedback as a way of rethinking potentially about your study design, kind of starting that all over again. Lots of variation out there in relation to different types of approaches. I'm not going to go over all of these in detail today. As you saw in the first slide, we teach courses on each of these. So if you're interested, please take a look at some of our online training. But today I want to focus on the ones I've circled here at the bottom. So the kind of umbrella term, rapid ethnographies, and all of the different variations of that label, of those approaches, covering short-term, quick, and focus ethnographies as well. Next question I always get is this one. So what do you mean by rapid? And I can never answer it because there's no real consensus out there. So I've given you here a flavor of what's been mentioned in different publications around how we might define rapid approaches, but still no real consensus out there and lots of variation. And we set out, when we carried out this review a few years ago now, looking at the use of this label rapid ethnographies within the context of healthcare delivery. And one of the things that we wanted to look at was actually, well, how is this operationalized, right? So what do people establish as a proper study duration for rapid ethnography? And we found lots of variation, and really what we saw were studies that were fitting anywhere from 5 days, which is incredibly rapid, to 6 months as well. That's further complicated by other approaches within, for instance, the rapid evaluation field, where you might be running a rapid feedback evaluation or a rapid cycle evaluation, and these are evaluations that run perhaps over a few years. But what you're building into and why you're using the rapid kind of label is that you're building in quite short and intensive periods of data collection and analysis. You're creating findings, and then in these feedback loops or cycles, you're sharing those findings with stakeholders. And I mention this because some rapid ethnography have started to take that, have started to incorporate that design as well. So it's something important for us to consider. And I've got a few of my doctoral students carrying out rapid ethnographies following that model as well, and we can talk about that at the end. I think an important thing to consider when we talk about rapid ethnographies is it's important to look at them not in isolation. I think I don't think rapid ethnographies kind of emerged out of nowhere, and they're not something new as well. So whenever I teach these courses, I always try to point people in the direction of kind of the rich history, of course, of many of these approaches, rapid ethnographies within a wider field of rapid research, many of them developed by anthropologists. And also this idea that anthropologists for a long time, especially applied anthropologists, have been talking about applied research and applied ethnography in particular. So I point people in the direction of this book as a starting point. But I think one of the key things in looking at applied ethnography is looking at the fact that these authors have tried to highlight the reasons why an ethnographic approach is important, is different, right, to other types of approaches, and try to really make the case that if we are going to, for instance, you can see some of the lists here in terms of it providing unique insights. If we're going to develop studies where we are able to focus on that insider perspective, we're able to explore perspective in relation to practice, right, that everyday practice element of ethnographies. If we're going to be able to consider multiple levels of analysis, right, the micro, meso, macro type of analysis, considering the individual within the wider context where they exist, but looking at the historical roots of that as well, considering individuals, the richness locally, but also what's happening at a global scale perhaps. And within that, looking at this interaction of actors and organizations and bringing all of that complexity in it. If we're going to do that, right, because we really value that approach, then why can't we think about potentially using those really rich findings and trying to explore how we might actually be able to, develop a study where the findings can be used to inform what we always say, which is changes in policy and practice. So really looking at ethnographic research as a way to improve the lives of the people who share their stories with us. And I think it's really important to remember that route, because lots of the critique of rapid ethnographies is linked to that, right? The critiques around it's very instrumental, it's devoid of theory, it's devoid of, it cannot integrate critical perspectives. I'm going to talk about critique for quite a long time, but it's thinking about what was the rationale behind the creation of these approaches. If you're developing a rapid study, why is it rapid? What is it responding to? So it's thinking about ethnography in that way. All right, so what are these rapid ethnographies then? This is what we all want to hear about, and I'll talk about definitions, and then I'm going to pause for a bit so we can have a bit of a chat if people have questions. So many definitions out there, and that's the reason why we carried out that review that I showed you. And I've got another slide after this one where I talk about a working definition that we created. But some of the initial debates around rapid ethnographies have centered around, well, what do we mean by rapid and what do we mean by ethnographic research? And this is some of the key contributions that researchers like Sarah Pink, like Hanswerker, like Knobloch, which I'll talk about in a bit, have made to the field. So for them, rapid ethnographies are still informed by theories and methods used, in conventional or traditional ethnography, but they seek to deliver findings over shorter periods of time. Now, in order to do that, in order to deliver findings over shorter periods of time, but still collect quite rich ethnographic data and be able to engage meaningfully with research participants, what some of these authors have argued is that you require quite important theoretical and methodological shifts in the way in which you think about ethnographic research. And one of the ways in which you do this is you delineate your field in a different way. You do this through more targeted and more focused research questions. And towards the second half of the session, where I go into practicalities, I'll show you how you can actually do that in practice. You also organize fieldwork in a different way. They talk about the intensity of fieldwork is increased, and we'll also talk about that today. And many of these approaches, even if you're carrying out research as a lone researcher, they rely on collaboration. So many times when I talk about rapid ethnographies, I also talk about collaborative ethnography as a result of that. But this importance of looking, and going back to this point I was making earlier about the fact that many of these approaches have been developed because we want the findings to be used, really. And in order for those findings to be relevant, you probably need to engage with stakeholders and people who are going to use the findings at a quite early stage to make sure that the study really aligns with those aims. And in our team, we always talk about the 3 R's of research. So research that's rapid, relevant, and responsive. And I think rapid ethnographies are an approach that really allows us to achieve those 3 R's, those goals. Now, within all of these different labels, and you'll see, I'll talk about terminology in a bit, there's lots of variation. And one of the things that we sought out to do when we carried out this review was to develop a working definition, right? Definition that, of course, needs to be tested and can be critiqued and unpacked in many different ways. But we sought out to develop a working definition for rapid ethnographies, which really involves some of the 6 points that you see here. And I've touched on these already. We're talking about short time frames. We're talking about capturing social, cultural, and behavioral information. And really, for me, the key is that focus on human experience and practice, right? So this idea that there'll be a participant observation, or at least an observational component, integrated into these studies to look at how things actually occur in practice. And one of the things we always say is, what people say they do isn't necessarily what they do, so that's why ethnography is important. So thinking about that from a methodological point of view, but then also looking at rapid ethnographies as approaches that can integrate anthropological or also theories from other social sciences. So this idea that even if you are doing, just because you're carrying out a rapid study, it doesn't mean that you need to sacrifice theoretical engagement. And when we carried out this review, we used the term quick and dirty, and we added a question mark to it because we were actually critiquing it. But this idea that a very dominant assumption that we've got in our field, that where we equate rapid with something that's quick and dirty, something that is sloppy, right? Something that doesn't really produce any kind of high quality findings, and which will be incredibly instrumental and will not engage with theory, etc., etc. Now, of course, there's lots of examples of that in the literature. We also have lots of examples of long-term research that actually hasn't engaged with theory as well. So for us, it's not necessarily a matter of time. It's a matter of how you design, how you implemented the study, and it's a matter of how, as a researcher, you approach the process of research. And I'm going to talk about that in a bit, but I just wanted to flag that we've integrated that as one of the key components of that definition. Normally, rapid ethnographies tend to collect data from multiple sources and triangulate them during analysis. You could have more than one researcher to save time and to cross-check data and to add all these different layers, as I was mentioning before. And we've added that 0.6 there as a way of starting to improve the way in which we report our findings. One of the key findings from this review was actually there were lots of gaps around how people reported their study design, but also their implementation, changes that they might have made along the way. So we're starting to look at clarity of reporting as our areas of work. So I can come back to that at the end as well. I think, like I was mentioned before, I have more and more doctoral students approaching us in the team or coming to the courses that we deliver at the university to say, I just realized I've got 6 or 9 months to do my study and I want to do it properly. And I think one of the interesting things about rapid ethnographies is that it would give you the tools to not just take a more conventional or traditional ethnographic design and say, okay, I'm just going to chop it and do it in 6 months. But actually, what are some of the techniques that I'll talk about a bit later today that you can integrate into that design to make sure that you're still generating quite a high quality piece of work, but you're just doing it over a shorter time frame, and also giving you the tools to reflect critically on the limitations of that. So I'm going to talk about kind of challenges and issues with rapid ethnographies. And I think if you find yourself in that situation where you say, I'm going to do an ethnography, but I only have 6 months, there's this incredibly, large body of work that has already reflected on some of the issues and limitations. Can I take a look at that, consider that as I'm designing, so that I might be able to address some of the challenges before I face them in the field? Definitely.
Cecilia, you've got another question from Martina. The question is, how could rapid ethnography be used in a meaningful and highly ethical way within sensitive research? For example, homelessness among illegal migrants, etc. She's worried that she's perhaps asking a too broad question. I don't think you are. There you go.
No, I think it's great. I think it's a great question. There's some interesting examples if you're able to kind of be a bit patient. I've got a few examples of rapid ethnography so you can actually see how they've been designed. And one of them, it's a slightly different population, but there's a really good piece by Scaras that looks at the use of rapid ethnographies in contexts that are difficult to work with in general. Difficult because of many different things. I mean, she's looking at conflict zones, so slightly different scenario, but it's a really interesting reflection around the fact that many of these approaches, and in that paper they're talking about a focused ethnographic design, many of these approaches are actually more, I think, relevant to the work that we might do with more vulnerable populations, harder to reach populations, sensitive topics, than maybe the more traditional, immersive, long-term types of design. So I think it's definitely appropriate. It will depend at the end of the day, like I always say, on how as a researcher you approach design and implementation. But if you're okay to be a bit patient, then I can show you some examples of how it's been applied in practice. And in the list of resources that I'll send down, I've got we've created an annotated bibliography of rapid ethnographies, and there's a few that have been already published with populations like the one. Excellent. All right, so we've talked about what do we mean by rapid ethnographies. I like to start off before I even get into what does it look like and all of that. I like to start off with a discussion about challenges, just because I think it's important to set the scene, and also because rapid ethnographies have, I wouldn't say a bad reputation, but I think there's lots of dominant assumptions out there that with rapid ethnographic designs, there's a lot that you would probably miss compared to a more long-term or conventional ethnographies. And I've got a bit of time in this session to share an experience of presenting at a conference, and I'll just give you a sense of where the critique really lies. But anyway, challenges that I think can completely be addressed, but still, as we're designing some of our studies, we need to keep these in mind. So the first one that you see here is this challenge between the breadth versus the depth of data, right? So we've got a short amount of time to carry out our fieldwork. Of course, the more we can cover, probably the less amount of depth we can actually go into. So it's something to think about as you're designing, right? Sometimes it's thinking, well, maybe less is more, in the sense that if I can focus on fewer examples or fewer sites, and of course, having said that, there's lots of rapid ethnographies that have taken on a multi-sited type of approach. So many of you are probably familiar with multi-sited ethnographies, that type of design of covering multiple sites of research and perhaps doing a more of a comparative piece during analysis, that has been integrated into rapid ethnographies. But it's thinking quite strategically about breadth and within kind of space, but also in terms of time. And linked to that is this second challenge around sampling, and how you might design sampling in different ways if you are carrying out your study in a shorter amount of time. With sampling, there's interesting challenges around, so there's an assumption that if you are pressed for time, you might actually be more inclined to recruit participants, who are most easily accessible, who are more interested in research, so are more likely to say no, and this would lead you to leave out harder to reach populations, as we were discussing before, or people who might actually have quite different points of view. And there's a few tools that I'm sure you're already aware of, because we use these a lot in qualitative research in general when we do purposive sampling, but lots of tools around the design of sampling briefs or sampling frameworks quite early on in the study, and using those as a guide as you're collecting data to make sure that you're touching and you're on all these different groups and you're representing all these different points of view in your study as well. There's a few other challenges here that I'm not going to get too much in the detail, because I know many of you are probably carrying out your ethnographies as lone researchers, but because rapid ethnographies many of these are carried out as a team, so this idea of team-based ethnographic research, there's lots of challenges associated with that, around managing people, managing personalities, but also around data collection and analysis and maintaining consistency. Many rapid ethnographies will rely on the use of research assistants, field assistants with perhaps lived experience or knowledge of the area, and there's lots of challenges associated with training and making sure that everyone's got the same kind of level of experience to be able to carry out the study. A few things that I think you should probably be considering, even as lone researchers, are the three at the bottom here. So this idea of ethnographic research being a form of engaging with our participants, engaging with our field sites, of creating relationships over time, right, and using those relationships to generate a different layer of insight into our study, right, and of course, without negating the fact that long-term engagement is highly valuable. And I've been working on a topic that Anna mentioned before, looking at medical travel in the case of children diagnosed with cancer in Argentina that have to travel really long distances to access care. And even though my first exposure to that topic and to that setting was through a rapid ethnographic design, like I mentioned before, I've continued to work on that topic and to travel to Argentina and to continue developing my ethnography for over 10 years now. Yes, of course, that's generated different layers of insights, allowed me to track things over time and also in relation to different changes in policy in the country. However, the study that was carried out at the beginning that had a rapid design was still able to generate really, really important insight into the experiences of researcher, experiences of families, sorry. Another thing to consider, and there's some really interesting literature on this as well, is the fact that just because you're carrying out a study that is long-term, it doesn't necessarily mean that you're really engaging with participants. So one of the things that we always like to work on, people who take the training and researchers on the team, is this idea that engagement and meaningful relationships with participants are really dependent on how the researcher approaches the field and approaches research. So it's this idea of that disposition of the researcher to meaningfully engage with participants and to use that as a way to generate rich layers of data. And we can come back to that later today. I think the same thing goes for reflexivity. Reflexivity, and defining this as that kind of critical positionality, right? being aware of your self-location, being aware of how you, as a researcher, with everything that you bring to the table, right, with that, your lived experience, your gender, your ethnicity, social class, all of that, everything that you bring to the table, how that shapes, how that creates a particular lens through which you see the world, that then informs the research process, right? So you're shaping that research process yourself, right? But also how your presence in the field and your relationship with others also shapes that process. And it's being really aware of that throughout, and looking at it not as a one-off, like, oh, I'm going to include a reflexivity section in when I write my thesis or my dissertation, but actually looking at it as a process. And there's been a critique that rapid ethnographies are not able to do that because you need time to be able to do that. And we've actually done a lot of work to demonstrate that that's not necessarily the case, that it's not so much a matter of time. It's a matter of how you approach the study. And we've actually developed a model that we call a team-based reflexivity model, where we actually do that not only as individuals within the team, but actually do that as a team. And I'll have a few slides at the end to show you how we do it. Practicalities, loads of issues around rapid setup, ethical review and approval, the fact that even though we might be moving at a rapid pace from a methodological point of view, our processes at many universities, and for us in the health sector as well, do not align to that. And so many times having to face lots of very tangible delays in our study setups and implementations because of that. And considering that yourselves as well as you're designing your studies. Just wanted to give you a sense of, I always say rapid ethnographies are new, so I just want to give you a sense here really rapidly of their history, and looking at what we've tried to do is we've tried to kind of divide some of these rapid approaches in kind of two, at the top what we call more ethnography informed, because many of these were developed by anthropologists that had loads of experience with ethnographic research, but they developed different types of approaches for rapid, mainly qualitative research. But then considering what we have called, you know, the more rapid ethnographies, or this broad field, which are the ones at the bottom, which are relatively more recent, but still have links to this kind of history. And here we've started in the 1980s, but we've seen examples of some of these rapid qualitative research approaches from as early as the 1950s as well. So just giving you a sense of that. And we talk about families of rapid approaches as well. So you'll see, as you start, I mentioned this because as you start to get into this literature, you're going to see lots of labels, and some of them being used interchangeably, or people actually defining them in the same way but using different terminologies. So just wanted to, you know, for you to get a sense of the fact that this is kind of a family of approaches, not get bogged down in terms of the terminology, but actually looking a bit deeper and considering some of these features that I've mentioned so far, and using that as a way to define your approach. And as a result of that, so looking at some of that history and some of these early approaches, and then looking at some of the new developments, some of the things that we've done as a team has been to start to identify what are some of the features that are borrowed from other approaches, rapid qualitative mainly, and how those have been integrated into rapid ethnographies. And we've identified mainly these four that you see here, and you'll see these are linked to some of the definitions from all the way from McNally, Foster, Fishman, which was the first one I presented, all the way to the work that we've developed on rapid ethnographies. So this idea that you might start using a few more structured tools or manuals to guide your data collection, maybe your analysis, because that might help you speed things up, especially if you're working as a team, and you might want to ensure that you are maintaining consistency across researchers. That's where some of that might become useful. Integration of participatory approaches in research. I mentioned before the fact that I always try to talk about collaborative ethnography when I talk about rapid ethnography, and the reason for that is because lots of the work that we do is centered on that kind of really early stakeholder engagement to make sure that our studies are relevant and make sure that those findings can be used to inform changes as soon as we've got emerging findings. And that's linked to this last point around establishing feedback loops for dissemination as well. All right, so now we can actually start getting into what do these rapid ethnographies actually look like. I'm just going to check time here. I think we're on track. Around 11 o'clock, I want to have maybe a 3-4 minute comfort break, if that's okay. Rapid ethnographies. Okay, so I've got a few papers here where I've just kind of teased out the main aims and the methods, just to give you a flavor of what these actually look like in practice. And then I'll get into a bit more detailed description around the approaches and the methods and all that. So, interesting paper. Most of my examples are healthcare related, although I think I've got one on education. So hopefully, I think the take-home message for those of you working in other settings is many of these types of designs and the methods that they use could actually be, you know, applied in any context. So don't get kind of put off by the fact that they're healthcare. So this is a really interesting piece, and I've selected it here because I think it combines this idea of dividing the research in different phases and using different methods, and also using different time scales and levels of intensity is quite an interesting approach. So this is a study by Mulaney and colleagues. It's looking at exploring experiences of patients undergoing radiotherapy treatment, and it's designed as a quick ethnography, and I'll touch on what quick ethnography actually is. One of the things I like about that is they really early on, they realized that they needed to have a good understanding of the context where healthcare was delivered to really understand experiences of radiotherapy treatments. And so they carried out this early mapping phase that you see here, which was about 2 weeks long, which is quite fast. And they relied on observational methods. They did a bit of a shadowing of staff members, kind of following them around as they were their shadow. To really try to understand, you know, how staff members kind of flowed through these spaces, to understand interactions, but really to look at how patients moved throughout this pathway. They carried out informal interviews as they were doing some of the shadowing, and at the end, you know, the kind of output was creating maps. Like this is just one example. They've got a few in that paper to try to understand those processes. And then they had the second phase, which was slightly longer, which is what they call their experience phase, where they continued to carry out observations, but this time placing more of a focus on patients. And they integrated some interesting kind of visual methods around the creation of photo diaries. So giving them the patients cameras and diaries that they could fill out to document their experience. So quite an interesting design, and they used some of these findings to actually improve the way in which radiotherapy treatment was delivered in this hospital setting based on those experiences of patients. Another example, and this is looking at a big study. So it's looking at, again, this idea of doing team-based work, like I mentioned before, but also doing multi-sited ethnography, designed as a focused ethnography, and we'll touch on what that actually means in a bit. But if you look at the scale of the work, I think it's quite impressive. So they carried out field work across 8 primary care practices in 3 different geographic locations. So I think you definitely want to have a team here, and I think, I can't remember now exactly, but I think they are actually, you know, different field researchers had different responsibilities over these different geographic locations, and the idea was that they would become kind of experts in that context. And we've done that quite a bit ourselves before, where we've for instance, a study that we're carrying out at the moment across 8 different hospitals, and the researchers are kind of responsible for a site, and they really become experts in the context of that hospital. And what they did is they combined observations, carried out informal conversations with staff, a few more kind of more formal semi-structured interviews with staff and patients, and documentary analysis. So going back to our definition of rapid ethnographies, is kind of having multiple sources of data and bringing all of that together during analysis. And they use thematic analysis, and they organize that as a team as well. Just want to draw your attention to here, to the bottom of this slide, where I've kind of highlighted some of the rapid techniques. They had an early scoping or preparatory phase, and I'm going to touch on that when I talk about tips. They carry out standardized data collection through the use of tools. So you heard me talk before about some of these structured manuals or structured guides or tools. They've developed practice summaries, and these were summaries that were carried out as data collection was still ongoing. So this idea of running data collection and analysis in parallel, becoming an expert in your data as you're still collecting it. And I'll talk about how we do that in practice in a bit. And team meetings, talking about really frequent ones. So I always say the shorter amount of time that you've got to deliver a study, the more frequently you will meet as a team, or in the case of my doctoral students, the more frequently they will meet with me as a supervisor. and we'll talk about why that's important as well. This is the ethnography that I was mentioning before, quite different setting, also using a focused ethnographic design. Sorry, but this idea that researchers working in difficult environments, right? So this is looking at conflict zones. You might need to actually rely on some of these more rapid approaches because you can't physically be in that setting for a long period of time. Now, how can you make the most of that time in the field? And this is the argument that this paper makes. So this is looking at focused ethnography, having a researcher guide, a really experienced researcher kind of guide the work, but training and using local field researchers as well. Again, combining multiple sources of data, in this case, quite interesting integration visual method. So combining direct observations, so observations that the researcher does as they're kind of physically face-to-face, but also videotaping or integrating some video observations as well, combining those with interviews with teachers and students, and also this concept of hanging out that I'm sure those of you doing ethnographies have already seen, this idea of more unstructured, informal types of observations in more kind of unstructured settings as well. So just hanging out in different areas, and we do that quite a bit in healthcare, in waiting rooms and staff rooms, and in cafeterias, coffee rooms, etc. as well. Fieldwork has lasted only 3 months for this study, and still incredibly rich pieces of work have come out of it. As you read the paper, you'll probably get a sense of that. An interesting thing about video observation, especially for those of you who might be shifting to more distant or more remote ways of collecting data, one of the changes that we've had to make in some of our rapid ethnographies has been to either carry out observations. We do lots of observations during meetings, for instance, and many of those have moved to a virtual environment. So either being able to join those meetings ourselves as participants, as virtual participants, and carrying out observations in that setting, or asking for those to be recorded so that we could analyze video data afterwards, or even in the case of settings where we might have originally been able to, not necessarily a meeting, but let's say a consultation or another type of interaction that we would have normally been able to observe face-to-face, asking participants who are going to be there if we can't enter those settings because we haven't been able to enter hospitals for a while now, for those to be video recorded, of course, with all the proper consents, and then for us to be able to analyze that as a form of kind of secondary data analysis as well. So just, you know, a few ideas there if you've had to shift some of your original plans for data collection. All right, now I want to briefly, where are we? Yes, I've got a few minutes. I just want to give you a sense of some of the literature that has tried to really define some of these terms, and then we can stop for a bit. Happy to answer some questions, and then we can have a break before we get into all of the tips and practicalities and all of that. So we've talked about lone researcher ethnographies, and when I talk about these different definitions of terms and approaches, I like to distinguish between kind of the lone researcher, those are lots of shared characteristics, and the more kind of team-based approaches. So lone researcher ethnographies tend to rely on the use of one researcher for data collection. They might still rely on one researcher for data analysis, but they many times engage additional researchers to cross-check coding and interpretation during analysis. And in the case of my PhD students, that's where kind of the supervision team comes in, and it's something that you might want to consider as well, as I think it's a more meaningful experience for the PhD student to do that in collaboration with others, but also leads to richer pieces of work as well. You heard me talk about quick ethnographies. This is, sorry, it's a bit blurry. This is a good book as a starting point. This handworker proposes this term originally. And an interesting thing about the quick ethnography book is that it follows that more traditional anthropological definition of ethnography as a mixed methods approach, right? So many times I think there's this assumption that ethnographies will be generating only qualitative data, which is really not the case in many of the, it's not, for instance, those of us trained traditionally as anthropologists were trained that ethnographies are mixed methods. So many of us will actually include quant data into our ethnographies. And handworker continues with that tradition. I think that's where it's really an interesting approach. So lots of interesting things in this book around how you might integrate qual and quant data, but you can see here that Handwerker starts to set out a theme for these rapid ethnographies around creating clear vision. So this idea of developing quite focused research questions, a focused research plan, mapping it out, lots of early planning to make sure that you're using that time in the field to its greatest advantage. So you're using that time to some extent efficiently as you're carrying out field work. Another term you've heard me use so far has been this term of focused ethnography. This idea that you will be focusing on selective specifier focus aspects of a field, right? And in terms of features, this idea of having quite short-term field visits, but that they are focused enough so that you could actually generate quite meaningful pieces of work within the short amount of time. You've got an interest in a very specific research question. And an interesting, I think, an important comment made is that many times for focused ethnographies to really work properly, you need to have either some prior experience with the topic or the setting, or you might require a preliminary or scoping stage, which is something that I want to touch on when we talk about study design in a bit. Short-term ethnographies are incredibly interesting. This paper by Pink and Morgan, I think, is for those of you who are really interested in maintaining that quite rich and theoretical basis of ethnographies. This is, I think, the approach for you, because this paper really makes an argument that you don't need to sacrifice theory just because you're working within a shorter amount of time. And Pink and Morgan talk about the high intensity fieldwork that we've been talking about, the idea that you, as a researcher, you will implicate yourself in a different way. So this idea that you'll implicate yourself at the center of things happening, and as a result of that, you could create potentially richer pieces of data within a shorter amount of time. You might be drawing from that past experience or knowledge, like I've mentioned already, and you'll really be prompting kind of that active dialogue to generate those rich interactions with participants within a shorter amount of time. Now, those of you who know Sarpeng does lots of work in visual anthropology, so for them, using visual data is, and they talk about videos, I think, in this paper, is a good way of also generating quite rich layers of information that you don't necessarily have to analyze as you're collecting, but that you've got there as a repository for some more in-depth analysis after field work. Talked about lone researchers. Many of these approaches have also been adapted for team-based ethnographies. I don't want to get too much into this. I've talked about it, I think, already, but this idea that team-based work might allow you to perhaps include additional sites, bring in different layers of expertise as well. And this is why sometimes I really recommend this kind of either dual or small team-based approach during analysis of kind of PhD students with their supervision team. Yeah, and of course, covering more ground if that's a possibility for you as well. Lots of challenges with team-based research, just conscious of time. I'm not going to get into the details of these, but you've got the slides, and we talked about these to some extent when we were describing challenges in general within rapid ethnographies. All right, so before we go on our break, I want to have just a quick thing, and then I'm going to touch on it again when we come back, where I talk about rapid ethnography's reputation, because one of the things that I like to do with training is I like to talk about rapid ethnographies in quite a way, even though, as I'm sure you've noticed, I'm quite an active proponent of the of the approach, and our team has used them so much, and we've seen so many benefits associated with them. But I also want people that take our courses to recognize that to some extent, even though things have changed so much since we started working. So we started working in this field for about almost 10 years ago, and when we did, rapid ethnographies were clearly the black sheep, I think, of the ethnographic approaches. I think currently things have changed, and we see this in so many different ways. We see this in the sense that we are contacted a lot to be able to, like in this case, to deliver training on these approaches. My courses have increased so much in terms of popularity. They're now routinely, at first I had maybe 3-4 people taking them, and now they're kind of routinely completely booked, so there's a lot of interest there. We've written a book on rapid ethnographies and have published that, and it's been quite successful in that sense, but also because we are seeing this as we publish research, so publishing rapid ethnographies in journals where before that would have been maybe automatically rejected as it was not considered an acceptable approach. The same thing with funding, external funding, and funders being a lot more open to these approaches, and even the fact that you've now have different teams around the world, including our team, that actually focus on some of these rapid approaches. But having said that, I want to, continuing with the spirit of ethnographic research, reflecting on our own life experiences, what I want to do is I want to read, this is the introduction to the book that you've seen, and it starts off with a description of an experience that I had presenting on rapid ethnographies and collaborative ethnographies a few years ago. And after that, of course, I took detailed field notes of it and very obsessively reflected on my own experience of doing this. And I include that as an introduction to give you a sense of what the landscape out there might be. So I'm going to do this, and then we're going to have a break. All right, hopefully you can hear me all right. So here we go. A few years ago, I attended a small symposium focused on the use of ethnographic research to explore cancer care. It was organized at a well-known university in the UK and was attended by experienced academics, anthropologists, and other social scientists working on cancer care in the UK and abroad. I was asked to be a part of the discussion panel in the last session of the day. Since the goal of the panel was to bring together the main themes that emerged during the day, I wanted to provide my reflections on the current state of ethnographic research on cancer and propose ways to take it forward. One of my reflections was that ethnographic cancer research tends to be divorced from the realities of those who could use the findings. I talked about the benefits of ethnography, the additional layers of knowledge generated by its approach, its insights, its commitment to the value of human thought and experience. My argument was that these findings, these additional layers of meaning, were often left in articles or books and were not being used to improve the services patients received, the support provided to carers, or the work conditions of staff delivering care. I then went on to explain how anthropologists working in more applied settings were developing approaches such as rapid ethnography and collaborative ethnography. As I mentioned these terms, I could see expressions around the room change. I continued to talk about the need to involve other stakeholders from initial stages of study design to understand how they might view cancer care and see if any of the findings of the study would be useful to them. This led to a bit of murmuring. My brief presentation then queried the ways in which we share the findings in ethnographic research. Could we be doing this as the study is ongoing? Could we share the findings in accessible ways? These questions led to some angry faces in the audience. Needless to say, several hands went up to ask questions straight after I finished talking. After a few minutes of heated discussion with quite senior academics, and I was a research fellow at the time, I concluded that I would not be coming out of that room with any form of agreement or even an agree to disagree stance in relation to the ways in which we could make ethnographic research more timely and accessible. Had I proposed something so radical to generate this type of response? Why did my proposal to do this type of research make so many anthropologists feel uncomfortable? I wasn't oblivious to the fact that the term rapid ethnography was considered contradictory by some anthropologists who define ethnography in relation to the long-term engagement with a particular field. Ethnographic research and fieldwork have changed so much since our traditional Malinowskian past that I did not expect such a rigid response from the audience. We're used to reading about multi-sited ethnography, mobile ethnography, virtual ethnography, autoethnography, and even fiction ethnography, all with different coverages of space, time, materiality, and aspects of the imagination. The questions from the audience also alluded to concerns about producing ethnographic research with others. If the ethnography is co-produced, is the voice of the researcher censored in some way, I was asked. There were interesting dynamics about the authority over social realities and authority over the text emerging. My reply to that question went along the lines of, well, isn't this authority always negotiated, even if we do not explicitly co-produce our ethnographies? The audience was not interested in seeing beyond the potential dangers of doing ethnography rapidly or collaboratively. Had I hit a nerve? Was there something about disciplinary identity here? If we reduce the time frame of ethnography, if we change ethnography in its purest form, then everyone will be able to do it. If everyone can do it, what will be our role as anthropologists in the production of knowledge? There was a hint of defensiveness in some of the comments, but what had I attacked? Or better yet, what were they defending? My reflection, and as you can see, obsessive dissection of the events that transpired that day allowed me to see that the proposal of doing rapid ethnography could potentially pose deeper questions about what ethnography is. If ethnography is not defined by the amount of time one spends in the field, then what makes a study ethnographic? What is or should be the purpose of the work that we do? What is our responsibility towards those who share their time and stories with us? If we are able to share findings at times when these can be used to inform decision-making processes, then shouldn't it be our responsibility to do so? 2 questions, I think, in the chat. So, is rapid ethnography designed mainly for saving time? Are there other merits compared to ethnography? I think there are other merits. If you're happy for me to go through more of the design and implementation practicalities slides, then I kind of touch on those, and then we can come back to that question at the end if you feel I haven't answered it. That's all right. Second question, advice on mixing auto and rapid ethnography. Forms and tools might that involve? I think it could definitely be done. I'm trying to think of any practical examples of a more rapid auto ethnography. If I remember correctly, I think there's probably one in the list of resources that I'll be sending to Anna. With autoethnography, just for background, this idea of you're really in a way describing your own lived experience or the self, and that is kind of the field is actually yourself, and that's where you might even generate descriptions to then, of course, inform the research you do in other settings, or it could be kind of the lens through which you see other realities, but normally you are your field site. I don't see that as a problem with a more rapid ethnographic approach. So I think lots of the tools that I'll talk about in a bit probably help in facilitating that. All right, sorry. I need to get back to sharing application. There we go. Hopefully you can see that as well. So just recap before the break, talked about my own experience presenting some of these approaches and what that generated in the audience. And I think an important thing to consider is that there's loads of assumptions out there around that really shape that reputation that rapid ethnographies have. I've listed some of the assumptions here around linking time to generating relationships, linking time to capturing changes, linking time to looking at richness and complexity, not losing the serendipity behind ethnographic research, right? To the finding of the unexpected, what you hadn't planned, what you hadn't included in your study design. The ethnographic text, it taking time as well, and reflexivity in time. So I'm not going to get into these in a lot of detail now, because all of the practicalities bit touch on and all of these and how you actually integrate and address some of these issues when you are designing your own studies. All right, so talked about the beginning. When we were looking at definitions, a key thing that comes out of definitions for focused ethnography, short-term ethnography, and I think even for quick ethnographies, is the fact that you would really benefit from having research questions before you started rapid ethnography. Now, sometimes you have been working on these topics for a really long time, and so it becomes quite easy to be able to develop these. But as doctoral students, you might actually be approaching a context or a particular topic for the very first time. So what can you do to make sure that you are developing quite focused research questions for your study? What I've done here is I've listed a whole range of things that we do when we're preparing for rapid ethnography. So we talk about a preparatory or a scoping stage, and you saw that as part of the features that we've identified for some of these approaches. Anywhere from including rapid reviews of the literature, reviewing theoretical or conceptual frameworks that have been used in the past, reviewing available data sets if you're taking more of a mixed methods approach, Looking at one of the things that I find really helpful is actually reading other rapid ethnographies that have been developed to study the same topic, or even if they've been carried out in the same context. And I think this annotated list that I'll be sending you would probably be quite useful, but there's loads of other things out there that you might want to look for as well. Those are, I think, more of the formal reviewing techniques that we might use. But then some of the things that we do that I think are incredibly helpful are all of the informal conversations or informal observations or touring, some of the chats that we might have with users of findings. With informal conversations, this could be other research teams that have worked on similar topics or have even carried out rapid ethnographies themselves to get a sense of what some of the challenges might be and address them early on. It could be having conversations with potential participants, right, during this kind of scoping stage of the scoping as a way of identifying the scope of your work, right, so defining it in that way. Also talking to those who use the findings to make sure, of course, that the study is relevant to them. So all of this, considering this as part of the research process, right, and using this information then to develop your more focused research questions. One thing that all of my doctoral students have to do, and there's no exceptions here, is they need to develop their own study design table. So the study design table is quite a practical tool, especially when you're starting out, where what you're doing is you're starting to map your research questions in relation to your methodology and in relation to what you expect to generate generate in terms of data, right? And the reason why they do this is because it helps, first of all, it helps structure thinking, but then it also ensures that you're not developing a disjointed study in the sense that you're not integrating, let's say, methods that are not aligned to your research question. So a typical one for me has been looking at studies, for instance, that's where they might have research questions that allude to people's practices of doing something, right? Or to understanding processes, let's say, or people interacting with particular processes, and then as a method only including interviews with participants. And the key thing there is, well, if you are only interviewing people and you're not carrying out observations, then you are capturing perceptions of practices or perceptions of processes, but you will not be able to actually document how those are, carried out in real. So in order to avoid that, the study design tables become quite useful. And because we've got this kind of rapid focus, the two last columns here are incredibly useful in allowing researchers to identify, first of all, to make sure that the methods that they're using will generate the data that they hope to obtain, but also this question of when will I have good enough data, allowing you to identify the moment when you could actually stop your fieldwork as well. And what I've got here as a slide is just an example of how we've done this in practice. Now we're a bit tight in terms of time, and you're going to have a copy of this. I think just to give you a quick overview, this is a study where we were looking at what we call specialing or one-to-one care. So this is when a patient requires a member of staff to be with them for various different reasons, but to be with them next to their kind of bedside on even sometimes on a 24-hour basis as well. It's an incredibly kind of expensive service, and so there's lots of research and concern in relation to this, thinking about the NHS and the best use of resources, but at the same time looking at patient safety. It's quite interesting. Quite interesting topic. But anyway, we carried out a study in a hospital looking at this. There were multiple research questions here. I've just given you an example of one. And it was all about decision making. So how are decisions related to the use of one-to-one care made on the ward? As you see here, we've set out our methods for data collection. And when we started mapping what we wanted to obtain in terms of data, as you see, one of the first things we had to think about was, okay, if we go back to that research question, we're looking at decision making. What do we think are the different kind of components of decision making? So there'll be a component around perceptions of how decisions are made. We'll know that then there'll probably be a component around the fact that perceptions might be very similar to the ways in which decisions are made in practice, or there might be a bit of a mismatch. So we'll have to really try to document decision-making processes in real time as they happen, right? And then many of these decisions will probably be shaped by protocol or documents already set in place, and we really wanted to include that documentary analysis view as well, and also because we wanted to examine that relationship between what's already been agreed at a hospital level, let's say, or even at a ward level. So what's the official kind of pathway or official way in which these decisions should be made, and actually try to compare with, how does that actually happen in practice? Do people align to that pre-established or agreed way of doing things, or are there any types of negotiations or diversions from that? And when those diversions or negotiations actually occur, the most interesting thing is, why does that actually happen? So you're starting to see some of that coming out in that column around type of data we think we'll obtain, right? So going back to the methods and saying, well, actually, if we apply this is probably what we will generate. And then thinking through that even more and actually saying, okay, well, when do we think we'll have good enough data? So we knew we wanted to capture a wide range of perceptions, and that then went on to shape how we sampled our participants, right? So starting to think about what you'll need to do at later stages of design, but also trying to look at, and this is going back to that question that was asked at the beginning, how do you make sure that you're capturing the wide diversity of situations? How do you feel that, how do you make sure that you've captured hard to reach groups, but also those that are negative cases, or individuals who might have a completely different point of view than the ones that are more dominant, right? So trying to make sure that you are including that in this last column around when you think you'll have good enough data. And for us, it was all about capturing all the instances when decision making was clear, there were no issues, but really also trying to have quite tangible examples of when it was not clear, when it needed to be negotiated, focusing on conflict and tension and how those were resolved, because we thought that was a really good way of capturing this kind of wide range of decision-making processes. And linked to that was also this thing that I was mentioning before, this idea around making sure that you're tracking the decision-making process as set out, as agreed, the official, process, but then all the deviations and why those deviations occur as well. And creating this design table was really useful to make sure that then, as we moved forward with the rest of the study design, we were able to carry out the study in a short amount of time while still being able to capture all of this richness. So that brings us to, how do we select our methods? The review that I mentioned before that mapped rapid ethnographies in healthcare, one of the things that we did there was actually we tried to map all of the different methods that were frequently used in rapid ethnographies. Nothing, I think, surprising here. As you can see, most of them have tried to combine some form of interviews with some form of observation, some of them adding focus groups perhaps, and some integration of these kind of mapping and surveying methods as well. But the most common, I think, combinations has been interviews, observations, and in some cases, some documentary analysis as well. And this idea that you will triangulate during data analysis. Within observations, because observations are so important to ethnographic research, we see lots of variation, but also bear in mind, and here pointing you to literature so you can take a closer look. Many of these papers are essentially carrying out the same type of observation, but they're just calling it differently, right? So there's a few things around terminology here that you need to be aware of. I've included a few things here at the bottom as well, which are other techniques that we've used quite a bit, which are more unstructured. Similar to shadowing, these ideas of hanging out, walk along, following types of observational techniques. And for those of you interested in things like mobile ethnography, lots of integration of those more dynamic ways of observing people or things, or even processes, and integrating that into rapid ethnographies. Other things to consider as you are carrying out observations and then transforming those observations into different types of notes. It's this idea of having, especially if you are involved in quite intensive episodes of observation or situations, that you might be moving from a jotting space, so capturing a few words just to act as a memory jogger, and then maybe at the end of the day or in another time point where you've got more time, then developing more detailed field notes to describe what you've just seen. And I always mention the example of a piece that we did during ward rounds, right? So when medical teams are going and discussing patients that are so intensive and there's so many people involved, where all you can do really is jot different words down to remind yourself of what you'll be describing in more detail probably later that day, and doing it, of course, as soon as possible so that you don't miss all of that detail. Now, another way to make to be able to streamline to some extent your notes as you carry out observations, and this is done a lot, especially if you're working as a team, is the use of a structured observation guide. And I put an example for you here at the top corner. A structured observation guide could be something from a table where you're actually trying to remind yourself, what are all the categories of information that I'm supposed to be observing? Some people like to design them in the form of questions, so questions for yourself, right, reminding you of that. Others just have words. You know, it's different ways of doing this. I think the idea here is to help you to guide yourself in the moment in terms of what you should be focusing on. And I find these really helpful if I'm observing situations where there's lots of things happening, and because my research questions are probably very specific, right, because I'm doing a rapid ethnography and I've focused them from the very beginning, I probably know that I need to leave some stuff out. And so structured observation guides can be a good way of reminding yourself, making sure that you are quite targeted. And then how you record your field notes really depends on you. For some people, it's just, you know, more summarized field notes, but you don't necessarily have to lose a lot of the richness. It could actually be that you continue to document your notes in a more unstructured way, but you're just using that as the structured guide actually as a guide to make sure that your notes are focused. Here are some other suggestions by other researchers around different types of diaries or field notes, from brief diaries, brief field notes, to more expanded one, depending on what the aims of your study are. And again, looking at different types of notes as well, from substantive, more descriptive notes perhaps, to more reflective notes where you're actually bringing yourself into the writing, and more analytic notes where you're starting to make lots more interpretations and maybe even linking what you were seeing maybe to other studies or to a theoretical framework. Sampling, I've talked about different challenges with sampling. One of the key things in many of these rapid ethnographies has been the design of sampling briefs or sampling frameworks, normally in the form of tables like you see here. And this is all about mapping early on who you would like to be approaching in the case of participants as you started with data collection, right? So this, you see it, the top example, the table in blue. This is mapping different types of healthcare professionals, so from different professional groups, but also because it was looking at capturing different experiences at different time points, so before an intervention and after the intervention, also mapping interviews across those stages as well. And these sampling briefs or frameworks, the idea is that they're working documents, right? So many times what happens, and this has happened to us, I think probably in all of our studies, is you start identifying additional people that you probably need to approach or to talk to, and the idea is that you can change that framework then. Again, the sampling framework, the one at the bottom, is all about sampling sites. So this is to sample 8 study sites and to sample them based on very specific characteristics, as you see here. And one of the things that we do in some of the more rapid multi-sited ethnographies is we might be sampling sites where we carry out more high-level research versus those where we might carry out more in-depth, right? Because we're pressed for time, we might have limited resources. We probably could not carry out in-depth research across the 8 sites. But instead of losing the variation in context, what we might do, of course, recognizing all of the limitations and the caveats, etc., associated with it, we might actually want to still keep 8 study sites, do more in-depth research in 4 of them, and maybe more high level in the other ones. And of course, we'll miss a bit of the depth, but we will still be able to capture variation if that is the aim of the study as well. Looking at sampling frameworks as a way to organize your observations as well. So doing a bit of mapping early on, and the one that you see here at the bottom is linked to that study on one-to-one care that I've mentioned before. So what are some of the interactions or meetings or situations that we might want to observe in order, again, putting that as part of that study design table, right? So in order to generate the data that we want to generate, because the data that we want to generate will allow us to answer our research questions, what are the things that we need to be observing, and mapping that from very beginning of study design, and then using it as a guide during data collection to make sure that you're making the best of that kind of fieldwork stage. An interesting book that if you're interested in these fields, that I want to recommend is this one called Creative Teamwork. This was a massive multi-sited rapid ethnography carried out looking at care homes, delivery of care homes in multiple countries as well. And one of the things I found really interesting about this research is that they carried out really intensive periods, so 1 week at each site, right? And the way in which they were able to do that was they were really, really specific in how they sampled their observations. And you see here, I've listed for you a few ways. So doing an initial kind of tour of the facility, so that touring and generating research questions, unstructured field notes through the kind of tour, and then organizing shifts. Of course, they're working as a team, so they could kind of, normally they carried out observation in pairs. This idea of having shifts that started to cover different times of the day, but then also being able to cover different days of the week to see how, you know, there might be some variation if things happened over the weekends or things during the week. And then an interesting thing that they did is they organized this flash visit, which was they had a 1-day intensive field visit at another care home in the same kind of setting. So again, they did this approach that I mentioned before, where they did a more in-depth piece and then a more high-level piece. And even though, of course, in 1 day you're not able to capture all of the diversity and richness, they still had a glimpse of what was happening in another care home in the same kind of region. And they could use that as a comparator to some extent. All right, so iterative design is really, really important in rapid ethnography. So there was a question here before around, you know, is it only that you're carrying out the study in a shorter amount of time? And I would say short amount of time, of course, is important to consider, but it's also about how you're really implementing these stages. And I'm not saying that in more conventional ethnographies you don't touch your data until the end, but there tends to be a tendency that you would normally carry out field work. You might write some of your field notes, but you're not really actively analyzing your data until perhaps a little bit later, or you might create some gaps in your field work to analyze data. With rapid ethnographies, everything happens at the same time in parallel. And there's a few tools that have been developed to allow you to do that. And this is one that we've developed, and I've got an animation so that I can have a few minutes where I'm not talking, and then I have I'll put questions as well.
RREAL has adapted a tool originally used in Rapid Assessment Procedures, or RAP, to facilitate the collection and analysis of data in rapid qualitative research. RAP sheets are a table including the main categories of information collected in the study. These categories are based on the research questions, theoretical framework, or data collection instruments. As an interview is carried out, the researcher takes notes, even if they audio record the interview. The researcher then summarizes the key findings from the notes and adds them to the RAP sheet. When she carries out an observation or another interview, she adds the key findings to the same RAP sheet. The researcher will do this for each data source using the RAP sheet as a triangulation tool. The RAP sheet will start to grow in length. Some topics will repeat themselves, but gaps will also appear. These gaps can be addressed as data collection is ongoing. Different types of RAP sheets can be created, one for each researcher, each study site, population, or to capture changes over time. The RAP sheet can be used to discuss emerging findings and obtain feedback from members of the team or stakeholders, prompting changes in the study design. If changes are made in the RAP sheet, all researchers should make the same changes to maintain consistency. RAP sheets help create a quick summary of findings, but they also guide researchers as they set out to conduct more in-depth analysis. There are many creative ways to use rap sheets. Visit our website for more information.
All right, so the rap sheet, yeah, I'm not going to go into the detail. Oh God, sorry. Because we've talked about it. The animation explains that. Look, but it's this idea of creating a working document that allows you, at the moment that you start carrying out that first interview, the moment that you carry out those observations, you take notes, especially during the interview, even if you might audio record it to then do a fuller analysis, and you tease out the key findings from that and you add them to the rap sheet. And the same with the observations. And because you're using multiple data sources and you're using one kind of sheet, all of that's coming into that sheet and you're starting to triangulate your data. If you're working with the supervision team, you also have an ongoing kind of summary that you can share with them, and during those discussions with them, that could prompt maybe potential changes that you might need to make in your study design. One of the key things for me is this idea that you start to see some of the topics that you've already started to get quite a bit of information on. So this idea of going back to our study design table, of you're starting to map out the data that you're already generating. But then the most important thing is looking at the gaps and still highlighting gaps in data collection at a time when you're still doing field work, so you can actually address some of those gaps and before you finish field work, because many times we don't have the luxury or the opportunity to return to that data collection phase. Now, an important thing to consider is that there's different ways, and I've put here triangulation tool, but there's different ways of organizing them. If you're doing a comparative piece potentially across different populations, you might actually want to start organizing your data in that way. If you are comparing across multiple sites, you might want to do that as well. I've mentioned the study about where we've collected data across 8 hospitals. As data collection was still ongoing, and even after we've completed, we could quite easily put one table next to the other and compare across all of our different study sites and start teasing out some of the key kind of patterns or trends in our data. Also, if you're comparing over different stages, so if you're trying to look for changes over time, we do this a lot when we integrate ethnographies and evaluations. For instance, this idea that you might want to carry out a stage of data collection before you've implemented, let's say, an intervention. So there's like a pre-implementation stage, and then maybe early, and then post, and then you've organized your data in relation to those, and you could quite easily go and look across and start to see if there's any changes over time as well. Just giving you a visual, people normally get really, really interested in what does the tool actually look like, and really it's nothing fancy, it's just a table. For me, the RREAL sheets are not about the actual table in itself, it's about the process that they enable, right? It's this process of being in contact with your data, starting to synthesize and understand the key findings. And for my doctoral students in particular, I think that taking that step back, right, not getting so bogged down in the detail is important, but taking a step back and saying, okay, what are the key findings that I'm generating as a result of my ethnographic research, right? Taking that kind of more high level view, and then identifying what are the areas where I really need to go and get, really bring in the detail, that texture, all of that flavor. And it becomes a really good kind of conceptual guide. So it's not so much how you designed, what you've included. And here I'm just giving you an example of some of these, and also that you see that the bits in yellow are how the RREAL sheet has changed over time. So this idea that you might start with quite broad and general categories, but then as you start collecting data, you know more about it, get more information, you might break some of these up and create more detailed tables as well. But still always keeping this relatively short and manageable so that you can use it as a guide. And importantly, as a guide to then probably do more in-depth analysis as well. So the idea that analysis doesn't remain with your RREAL sheet necessarily, even though you can use it to share emerging findings with stakeholders if those are needed in quite a rapid kind of time frame, but that you could then actually go and do a bit more work. And what we've done in this review that you see here that might be useful is actually we looked at different strategies that teams were using to speed up that stage of data analysis. For many research teams, what they identified as a big delay was transcription. So there's quite a few different approaches, and these might be of interest to you as well, of actually bypassing transcription, some bypassing altogether, some techniques listed here in the table for you on how do you analyze directly from audio recording. and there's different software platforms that allow you to do that as well if you don't want to do it manually. In other cases, the reliance on notes. Other cases, not sending out for transcription. Sending out for transcription is incredibly expensive, so if you've got limited budget, different examples of use of voice recognition software, so you can kind of transcribe with software that's a lot cheaper as well. So different tips here for you guys to look at. But an interesting set of, and here I've just listed a few papers for you, has been the fact that many of these more rapid studies, ethnographies, and other, I think, qualitative studies have incorporated what we call more of these table-based methods into their analysis. And I've mentioned the RREAL sheets here. For us, the RREAL sheets are normally a starting point. And what we normally do is we use them as a guide to then lead us to more in-depth analysis. In our case, normally they use framework analysis, which I don't know if many of you are familiar with it, but I've put a few of the stages here. So for anyone that has done thematic analysis, I think all of the initial stages are probably going to be very, very similar to any type of traditional thematic analysis. What framework analysis allows you to do is it allows you, and I think I've got a visual for you, there we go, allows you to create kind of a matrix of your data set where you can organize your data in relation to both your cases and your topics, right? So cases being perhaps your different interviews, right? So you put those across the different rows. And topics could be the specific codes that you're using to kind of code the data, right? Following a more thematic analysis approach, or you could be grouping these even in kind of larger categories if you wanted to. What you put in the cell is you put the raw data here, so you kind of keep that link to your raw data. What I find really helpful about this approach is that it ends up creating a matrix of everything that I've got, because we normally include our observations, our interviews, our documentary analysis, and it gives you a view of your data that I find it a lot more, I find that it facilitates kind of the identification of patterns or trends in across my entire data set. So for me, that's quite a useful approach in that sense. And I think an important thing is the fact that, you know, if you're thinking about doing different things with your ethnographic data, for instance, what do? We do lots of vignettes and case studies where, you know, they might not fit into this framework, but seeing potentially the creation of a framework as a starting point and not feeling like you need to sacrifice some of the more kind of narrative ways of working through your data later on as well. Yeah, so that's just to give you an example. Another thing to touch on, sorry, especially if you're doing if you want to remain, you know, you want to continue, let's say, with a more traditional thematic analysis approach, but something that's quite helpful, especially if you're just starting out, or if you're working as part of a team, or if you've got supervisors who are quite hands-on during the analysis phase, is considering the creation of a code book as you're starting to kind of code your qual data. This paper is quite good. It's a bit old, but it really walks you through all of these different steps. And for us, the codebook is essential when we're doing team-based analysis, because the codebook is a way of creating a more kind of systematic description of the codes that you will use, how you define those, examples of when you might apply them or when you might not apply them, and making sure that different members of the team are kind of coding in a similar way. So just wanted to show that as another thing you might want to keep in mind. And sometimes, even if you're doing this as an individual researcher, in order for you to apply the code in a consistent way, it could be quite a useful tool as well. We've talked about reflexivity already, the fact that it's been identified as a challenge. I just wanted to point you in the direction of this paper that we published recently, where we actually engage with this in a bit more depth, and we look at the integration of reflexivity into rapid research, and the fact that, as I was mentioning before, that it's not necessarily a matter of time, it's a matter of how you approach the research project, and how you critically reflect on not only on the individual research project. So in the case of this model here, we reflect on our work as a team in general as well, and how you bring that learning back in, and how you use it in practice. So if that's something that interests you, just wanted point you in the direction of this paper. There were some interesting questions around ethics. You are all working in quite different settings, so I'm happy to take some more specific questions at the end. But of course, it's thinking early on about the potential delays that many of the ethical kind of review and approval processes that we need to go to in order to be able to start collecting data, potential delays those might have, and how they might impact on your study design as well. So just kind of here point you in the direction of a few things you might want to consider. And I really like this distinction between what we might call more procedural ethics, which are all of these processes for study review and approval, but also looking at ethics in practice. And a key take-home message for this is that even though we are implementing a study within a shorter time frame, rapid ethnographies continue to adhere to the same principles of ethics in practice as any type of study would. So you would not want to seek to, you would not want to cut corners in any type of informed consent process. You would still carry that out to its fullest extent, and everything in relation to data management and storage, you would follow the same kind of guidelines as any type of study. So it's important to I think, to touch on that. And then, you've been hearing me talk about from the very beginning about the use of findings and the reasons why many of these approaches were created. And I've just given you here kind of a list of different ways in which findings from rapid ethnographies have actually been used in practice. These are examples from the literature as well as studies that we have carried out ourselves as well, going from anywhere from diagnostic tools all the way to trying to inform and develop wider theories to explain perceptions, to explain processes and behavior as well. And a key thing, and this of course, it's difficult I think when you're doing a PhD, because you're so dependent as well on your supervision team, and if you're working for a wider project or a wider team, you kind of limited in what you can do. But one of the things I like to encourage everyone to do is to think about dissemination not as after the fact, right? Not as, finished data analysis, now I've got some findings, how am I going to disseminate them? But actually to integrate, even though I presented at the end of the study, actually when we design our study, one of the key things that we do during design stage is we come up with a dissemination plan from the very beginning. And I've just listed here on this slide some questions that we ask ourselves to be able to develop that plan. So it's thinking through dissemination, thinking through audiences, thinking through formats, timing as well as dissemination, and what you want to achieve during dissemination. Is it just that you're sharing findings with other people, or are you actually hoping to get some feedback? And this could include participants as well, so a process of kind of member checking or member validation. Do you want to share your early interpretations of the findings with them and take that feedback and bring it back and use it in your study design? And what I've done here, and I think lots of things have changed within kind of more traditional ethnographic research as well, around how we present our findings. So moving from that more traditional, the monograph, that book that shared all of the findings from an ethnography, to all these different ways of sharing findings with an academic, but also with a non-academic audience. And we've, in particular as a team, we've tried to experiment quite a bit with visual approaches, developing infographics, animations like the ones that you've seen, videos where we've got people talking about their studies, and looking to make sure that some of the findings of our studies are have a wider impact than just the academic community as well. And if you're interested in this, you can take a look at our website. We've got a few examples there that I haven't included in the slides. We've got a few minutes. I want us to have a bit of time at the end just to talk about any questions you might have, but just pointing in the direction of what we are identifying as the future of rapid ethnography. Some of these we're calling spin-offs that I'll include a few papers in the pack as well, so you can read up about them, different ways of experimenting with some of these approaches. I've talked about reporting as well at the beginning when I talked about the definition of rapid ethnographies. Lots of issues around reporting. At the moment, there's only, well, according to our knowledge, there's only one set of kind of criteria for reporting and appraising rapid research, which is this one created by Uterini, looking at rapid assessment procedures, or RAPs. One of my doctoral students is actually, her PhD is focusing on looking at quality and reporting in rapid ethnographies, and as a result of that, leading a consensus process to develop the new kind of standards for reporting in rapid ethnography. So kind of watch the space as that kind of develops into a potential future set of standards that we can use. This, I put it here because you'll get a copy of the slides. It's just to give you a sense of what I call kind of the life course of a rapid ethnography. So all the different stages in study design and implementation, and the questions that we ask ourselves as a team throughout all of these. So I think these are all the things that when we read kind of methods books, we don't really see. It's all of the internal questions that the team have asked ourselves, and the issues and the problems associated with, you know, the practical realities of designing and implementing a study. So there's a few slides here kind of guiding you through that. Included here a few things around the book, and if it's something that you want, a special discount code for people that do their training with us as well, and just some more information around training. But
has the privilege. One of the things I was doing when I was doing my ethnography was recording some of those notes on the tape recorder. Is this something you would recommend, or you think it's better to actually go into your tool, or both? Or what's your experience of that? Do you always go finish and type?
Do you mean in terms of the notes that we take during interviews?
No, when you've gone and done an observation.
Yes.
So I may have taken some notes and kind of similar things that you said, but then maybe while I sat in my car, I had another thought, and then I would take the tape recorder out and start saying, I just realized that. Is that something that you recommend? Is that something that you can then combine?
Yeah, I think, at the end of the day, people need to find what works for them. I think I've got colleagues who, exactly like you said, who are, for them, it's so much easier to verbally describe what they've observed. And so they might record themselves just reflecting on it. And then we might send that out for transcription and use that as text, or use, voice recognition software. And that becomes a really good source of information. I've got other colleagues who prefer to just then sit down and just write, because they feel more comfortable with the actual written description of that episode, and that's another way to do it. I think there it's flexibility around what works for you. To be honest, I don't think there's a right or wrong.
Okay, great. You've got a lot of questions.
Yeah.
You can read the chat now, can you? So I'll leave you to it.
I can. So I'm going to go to the first one. So the question around doing rapid ethnographies in the context of sensitive research was more about how to build rapid trust while working with hidden communities. Yeah, I mean, I think it's a challenge. To me, it's a process that, so one of the key things that has worked for us, especially when we've worked, and we haven't worked with kind of homeless communities, so I don't have any tangible examples around that. We've done some work recently looking in communities with people with learning disabilities in quite deprived areas. So, it's a bit of a stretch, but some of the things that we found really helpful around building trust and engaging with them has been to try to take a step back as a research team, and really we did lots of, even though we were pressed for time, we did lots of work at the very beginning to co-design the study with them. And that, I think, created a real shift in the way of looking at the study, because the process of co-designing it, and we can go into the details of how we did that, but really gave them a sense of ownership over the study, and it gave us a lot of access. First of all, it gave us a lot of knowledge, definitely, around the kind of the local setting. And then it gave us a lot of access because people were feeling that the study was actually going to generate findings that was going to be something meaningful to them, was going to be used in practice to actually improve lots of the services that they were receiving in their boroughs. And And that created a real shift in the way of looking at the study. And then I think many of the tools that I presented today around this more rapid analysis and being able to share findings with them on an ongoing basis, the fact that they could see something tangible. I think for people, actually saying, being able to see what you are, ethnography is something so abstract, right? But for them to be able to see, oh, actually, the fact that they've been talking to us and observing this means that they've been able to look at all these things, and now we can translate all these things into all these changes that will impact on my life, right? So actually making that connection and facilitating that connection for people really enabled lots of trust and really good relationships in studies that were really, really short. So that's, when I go back into this idea that, it's not time, it's how you approach it, it's how you bring people along with you, it's how you engage with them, that makes a difference. I hope that's useful. How would rapid data analysis work with discourse analysis? I haven't used rapid data analysis with discourse analysis, to be honest. I think most of the times when I've seen it used has been with more kind of thematic, and I haven't even seen it with things like conversational analysis. Now, thinking about it, I think it could still work. The only problem is with discourse, I think you'll have to have more of a direct contact with the original text, won't you? So it will all be about how people say things, not just what they're saying. You might actually need to have kind of a more targeted approach to sampling, so that you're not using kind of you don't generate volumes and volumes and volumes of data, right? So that if you are doing discourse analysis, you might want to work in a more targeted way. But I don't think for discourse analysis, something like framework analysis would work, because you'll be chopping up the data too much. You won't be able to kind of track some of the dimensions. I'm happy to look into it. There might be some other kind of people that have worked with it in more rapid designs, but I'm sorry that we haven't. Sorry, we've got a few minutes. Possible to rank rapid ethnography with ethnography? Yes, there's a few examples in the pack that have looked at ethnography as that have used ethnography, so kind of the whole net type, ritual type of ethnographies, and using more rapid approaches, and lots of work on technology as well that I'll send you guys so you could take a look. Templates are examples of the real rap sheets. Yes, on our website, there's some examples, and I can attach a few to the email I send Anna as well. There's a few on the slides, and you'll get a copy of the slides. And there's a question about slides. And there's thanks about the study. Thanks for the training. Thank you guys for listening me talk for 2 hours almost nonstop. Important take-home message from the real rap sheets is, I'll send you examples of the templates. Really, they're basically tables. It's really not that much. It's not so much about the templates, it's how you use it. So it's more about the process behind the real sheets. And one of our papers, the one on carrying rapid research in COVID-19, has a more detailed description, and the books as well. So,
well, it's 12 o'clock, Cecilia. What can we say? You're having these amazing comments on the chat. People, I think the word helpful sometimes get interesting, which I think it is really interesting. Thought-provoking, Andrew is saying, but I thought it was really useful, and I think our community will massively benefit from this. So I just, from the bottom of my heart, say thank you, because they'll take this learning for the thesis, but also when they go out there in the real world of being researchers, which they are now. So thank you so much, and thank you for your generosity in terms of all these resources you're going to share with us, and your availability. Your wealth of knowledge is immense. I think we're all being a bit like humble on our knowledge. You're an encyclopedia, and we're just so excited that you've dedicated this time to our community. Thank you so much.